We've had scenarios where a health plan has let several claims, the exact same claim, paid many times.
Wow.
Over and over again. That should never happen, but we see it all the time.
You do.
That could be a problem spot that we identify.
Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. Today we're talking about wasteful spending in healthcare. This is one of those topics that's hard to put in perspective. The Institute of Medicine says that 30% of healthcare spending could be categorized as wasteful, putting the total tab north of $750 million. It could be $1 trillion. Health insurance premiums are up 7% year over year, according to Health Affairs. Analysts point to inflation as a strong cause, but this nearly $1 trillion in unnecessary spending is not helping the equation. Bottom line, healthcare costs are out of control. They're driving many people into medical bankruptcy. If 30% of healthcare spending is unnecessary, we've got to get this under control. Thankfully, we've got founders in the startup health community who are passionate about this issue. Jude Odu from Health Cost IQ and Pinaki Dasgupta from Hindsight will help us understand in this episode what constitutes wasteful spending and how advances in AI allow us to root it out at the source. This is the kind of innovation that takes some courage, because pointing out to a hospital that they're double billing or an insurer that they're making massive errors doesn't make you popular with either party. But it's got to be done if we're going to get overall healthcare costs under control. Let's start with my conversation with Jude Odu, founder and CEO at Health Cost IQ. Jude, great to have you in the studio.
Thank you.
You know, you're tackling the issue of wasteful spending in healthcare. Anyone who's doing that is a friend of mine. It's such an important issue. So let's start with the challenge. Let's talk about how much waste there is and the negative impact that it has on real patient care.
Absolutely. So nationally, a lot of studies have been done on this that show that up to 30% of all healthcare spending at the national level is considered wasteful.
30%.
30%.
Okay.
That equates to $1.2 trillion annually in the United States. A lot of money that is going to waste.
Okay.
So this is a major problem in our healthcare system.
Are these numbers like highly debated? Like one person says it's wasteful, somebody else says it was a necessary test, an unnecessary test, or is this like stuff we all agree on?
It's settled statistics at this point.
Okay.
Several studies have borne out those statistics.
Okay. Give us some examples of what wasteful spending is.
It could be redundant care, care that is unnecessary, care that is wasteful. It could be billing practices by providers that are, below the table. Some providers do some shenanigans, if I may use that word, in their billing practices.
Like what?
For example, a surgeon that performs a surgery, let's say they do 5 procedures on a patient. Rather than billing it out as a single surgical episode, they go ahead and bundle it into 5 separate procedures.
Okay.
That nets them more money, but that creates a lot of waste within the system because it's causing the health plans to pay out more than is necessary, more than is required for that claim. So we have, for example, algorithms that will identify those unbundled procedures and bundle them back again on behalf of our clients.
That's a good segue into what Health Cost IQ is. What have you built? What does it do?
So Health Cost IQ is an enterprise SaaS ecosystem that is using technology to help self-insured entities to lower their overall risk and realize a lot of savings. And we're doing that by identifying costly inefficiencies that exist within health plans.
Okay.
We identify potentially fraudulent claims. We identify abuse and waste that occurs within the system.
Okay.
And there is a ton of those, to the tune that we've built over 100 algorithms tackling different scenarios for waste and inefficiency within health plans.
Okay, so your clients are insurers?
They tend to be self-insured entities. So
Okay.
they're like self-insured employers, consortiums of educational institutions that tend to be self-insured as well, risk pools that are pulling together to realize savings. It could be insurance captives, which is a relatively new type of organization that is coming up. It could be just your self-insured employer, mid-sized to large employer. Also, we have a lot of hospitals and health systems that are becoming self-insured because they see it as a way to save money. What they typically don't realize is that they are walking into a landscape that is fraught with a lot of waste and inefficiency.
Okay. So talk to me about some of the dynamics at play, because for a self-insured employer, they obviously want to find those savings, but you're also kind of pointing out errors and mistakes and waste. So what are some of those sort of stickier dynamics?
So for the most part, these entities know that things are not running as smoothly as they should. What they lack is the ability to pinpoint what the problems are. And that's typically where we come in. We have our algorithms, we have our predictive models that is able to shine a light on what those problem spots are. For example, if you have a problem with duplicate billing, we've had scenarios where a health plan has let several claims, the exact same claim, paid many times.
Wow.
Over and over again. That should never happen, but we see it all the time.
You do.
That could be a problem spot that we identify. A problem spot could be the issue of unbundling that I mentioned. Also, there are several claims that are sent across without the proper modifiers, which will specify precisely how much should be paid for those claims. So those claims, when they lack those modifiers, they tend to be paid out at a higher rate.
Got it.
Again, causing waste, causing inefficiency, and those are the kinds of things that we're able to identify. Most self-funded entities are simply not equipped to identify, or they need sophisticated
It's an administrative burden.
It is, and they just don't. And sometimes they give it up to a third party like an ASO or a TPA, who by and large are more. Their role is to pay bills. They're to pay claims.
Got it.
They don't have the equipment or the skills or the technology to really go to the depth that we can to identify those kinds of issues and correct them once and for all.
In the old days, to find a redundant bill, you might have been looking at spreadsheets, right, and trying to find things that match up. So now you're applying custom algorithms, as one does in 2023, to find these specific scenarios. What kind of savings can you find?
Depending on the size of the health plan or the entity, it could be several hundreds of thousands of dollars to millions of dollars for larger enterprises. And you mentioned spreadsheets, and I find that so interesting because when we go into, especially on the educational consortium side, we have encountered clients that they manage 15 to 20 spreadsheets every single month. You can imagine the amount of human error, the amount of typos, the amount of inefficiency that is involved. We have an automated data processing technology that we bring to the table, and that fully automates that process, takes away every single spreadsheet. And those guys, they're like, wow, I didn't know this was possible.
Yeah.
So
I often go back to sort of that feeling of the first time you used something like TurboTax, when you had been doing your taxes by paper, and you have the sense of relief.
Yes.
And a lot of technology kind of brings that sense of relief. What has been your traction of late?
So we recently did a seed round, so we're capitalized right now.
Congrats.
Thank you. So we're moving into the market. We are going to engage in a lot of sales activity to really take this product to the market, because we are first to the market with these types of algorithms. There's all kinds of algorithms doing different things, but to specifically target the self-insured space and health plans, we are truly the first to the market. So we are going to take this product to the market and make sure that the organizations, educational consortiums, self-insured employers, health plans, anyone that can benefit from the efficiencies and the cost savings that come with our platform, we want to make sure that they know about us.
I'm guessing there are opportunities as well as challenges with being first to market.
Yes, I mean...
Defining the market.
Yeah, we are going to define the market. Eventually, obviously, we know others are going to follow us. But one ace we have up our sleeves is that most of our algorithms are based on doctoral research
Okay.
that was never published. So but we believe we have a very strong technology
Interesting.
that is going to
Based
help.
off of your research?
Yes.
Got it. Okay, so that's your secret
Secret sauce.
secret sauce, superpower, whatever you want to call it. So you're coming from that research side. Very interesting. Well, Jude, I appreciate you stopping in and giving me an update on Health Cost IQ. Exciting to know that you're capitalized, ready to take off. You're in the early innings still, and I know you're going to do a lot of good. So we'll be watching you.
Thanks, Logan. Appreciate it.
Thanks a lot.
Thank you.
Be well. Next up is my conversation with Pinaki Dasgupta, CEO and founder at Hindsight. Pinaki has been using AI to root out wasteful healthcare spending for years, but he's seen an uptick in understanding and interest in his work thanks to the rise of generative AI technologies like ChatGPT. Let's get into it. Pinaki, good to see you again.
Same here. Great to see you, Logan. It's been, I think, about a year and a half since we are meeting.
That's right. I think maybe in Miami we might have done an interview.
Yes, absolutely. Yep.
So
Yep.
you're innovating. I love what you're doing. You're innovating by using big data to eliminate or cut down on wasteful spending. In my mind, anything that cuts down on wasteful spending in healthcare is a good thing. So tell us what you've built with Hindsight.
Yeah, not only just eliminating wasteful spending, but to do wasteful spending, payers end up spending big money just to do those reviews and audits by hiring nurse and docs who will go through the records to find whether it was wasteful. And that's where we are even eliminating additional operating cost for payers.
Okay, let's break all that down. So for an audience that's just not in the industry at all, maybe they're in healthcare, they know that they want to break down wasteful spending. They know that they want to spend every dollar possible on actual patient care. So walk me through an area that's a common area of waste and kind of some of the ways that Hindsight steps in.
Yeah, so one of the key areas is utilization management. And the way the healthcare addresses the issue is by payers doing prior authorizations.
Okay.
And also a lot of prepay audit happens for genetics, urine drug test. Even before the claims get processed, they actually run an audit. In all such audits, they will request the provider to send the actual clinical data of patients, and then they will go through the records to ensure that there are enough evidence that services that was rendered were necessary.
Okay, so how does your software speed up that process or make it better?
Yeah, so this is like going through hundreds of thousands of pages and literally looking for a needle in a haystack.
Okay.
Right? So we make that process seamless. We could automate that process. So we will say, let's say 30 to 50%. You don't need to audit it. You don't need to review it. Our machine learning and AI capability, machine can learn and can mimic the decisions of humans. And so 30 to 40%, right out of the gate, we can automate without a human touch. Okay. We can say, there are enough evidence found in these records, and you don't need to review it. And anything that is, it's not a slam dunk, we will offer it to our reviewers. But what we do is, rather than reviewers flipping through hundreds of thousand pages, in one click, we could get you to the page where those information are stored.
Interesting. Okay, now you're not a new kid on the block. You've been with Startup Health for 8 years and you've been in this business a while. Tell us a little bit about your kind of the big milestones over the last decade in terms of traction.
Yeah, it's a very, very interesting journey. Yes, we started in 2013. This year we actually celebrated our decades of relationship. It's great that I've been paying myself for the last 10 years, and it's been a fascinating journey. Healthcare is fascinating. A lot of innovation is happening today. When we started, AI was not an accepted term. Your big data was, but now AI, of course, suddenly everybody's talking about Gen AI. They're talking about LLM. So it's getting very interesting. So we receive a lot of calls today from clients, And I see a lot of interest actually, even in our social network, that, hey, you guys have been there for last 10 years, and now suddenly, it's like a huge boom. So that's interesting.
Is that actually translating into partnerships and clients, or is it just more excited conversation?
Healthcare, nothing happens overnight, as you all know.
Sure.
So it's not like, everything, I'm just getting checks coming in through the door. No, that didn't happen. But there are a lot of good conversations happening and quite a few pilots underway. And we are seeing application of our platform in very different industries that we did not touch. And when I say by industry, started with third-party adjudicators, benefit managers, moved into very large health plans, and now we are moving into MACs, Medicare, contract administrators who are managing the claims for multiple Medicare beneficiaries across the United States, and the new opportunities that is open up is, worker compensation, for example, auto accident. Some of these areas also requires them to go through the medical record to ensure that worker compensation is appropriate. Certain accident-related injuries and the payment associated with those are appropriate, and we are seeing some new use cases for our applications that we built originally for payers.
Interesting. Okay, I want to sidestep a second and make sure that we're clear on this idea of waste and educate our viewers on how much waste there is in healthcare based off of your experience, and kind of maybe put them in buckets, like understand where the waste is.
Yeah, so there are numerous studies done, and Health Policy Brief did it, and everybody came to the conclusion, about 30% of healthcare is wasteful and could actually be eliminated.
Yeah.
So if you look at the pie, that's translated to over $1 trillion. Healthcare now is, $4 trillion in the United States. So it's over $1 trillion. And one of the pieces is this administrative inefficiencies, like this prior authorization, risk adjustment audit, CPT audit, DRG audit, all kinds of audits and reviews. That actually takes a lot of the core healthcare provider, doctors, nurses, to do nothing else but reviewing records to find appropriateness. And that, I think, is a drainage. And by using AI, we could automate, we can augment these processes, and that's been our journey so far, and we like that.
Yeah. So what's next for Hindsight?
So the next is, next year we'll be raising capital. So far, we kind of did raise a small seed capital, and we have been self-funded and revenue generating, of course. Thank you.
Always a good thing.
Yeah, but now I think I am seeing explosion of our technology adoption in the marketplace that is coming. And to be ready, I need to invest in sales, marketing, and broadening our team.
Yeah.
And so next year, I'll be raising funding and expand our footprint, have sales and marketing to pound the pavement and bring more new clients.
How much of an advantage is it to you to have been a first mover in a market that I'm guessing now is getting more crowded?
It is getting crowded, yes, and even in the bus when I was coming here, everybody says they are AI, so I don't know really, what is AI, what is not. But yeah, I think there is we started when no one really was talking about AI, and today we had processed almost 35 million records in healthcare. And so the advantage that we have is our algorithm is way advanced than people who are now coming in.
Yeah.
And this learning of last 10 years, it could catapult to the next layer of our growth.
Got it. That's awesome. Okay, Pinaki, always good to get an update from you. I wish you the best as you kind of figure out what that next big move is, and as you cut out wasteful spending in healthcare. So thanks a lot.
Thank you.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.